Empowering and raising a new generation of adolescent girls and young women as family planning champions is key if universal fulfillment of sexual reproductive health and rights is to be realized. We are Girls Choose Smart Contraception Champions, working with my Age Zimbabwe Trust, a youth-led community-based organization working in Masvingo and Mashonaland provinces of Zimbabwe. We envision young people from Zimbabwe who are free from HIV and sexual reproductive health burdens that limit their meaningful participation in developing their communities. And we believe our mission is to be a trendsetter in reducing sexual reproductive health and HIV burdens among young people in Zimbabwe through facilitating youth-led, innovative communication and advocacy strategies for social behavior change.
Adolescent girls and young women remain a marginalized and vulnerable group with limited access to sexual reproductive health rights information and commodities, especially access to contraceptives for unmarried adolescent girls and young women due to traditional, religious, and social norms around young people's sexuality and sexual behaviors as perceived by the Zimbabwean community. Structural barriers including age of consent in accessing sexual reproductive health rights, and for contraceptives, it is left at the discretion of the service provider. The unmet need of family planning for unmarried adolescent girls and young women who are sexually active is at a high rate of 31.8%, and increase in incidences of unsafe abortions as well as mortality due to unsafe abortion, increased school dropouts due to early unintended pregnancies, increase in forced marriages, increased maternal mortality for adolescent girls and young women between the ages of 15 to 24, increase in sexual gender-based violence due to power relations and dynamics amongst adolescent girls and young women and their partners. All these challenges have greatly affected adolescent girls and young women in Masvingo and Mashonaland East rural provinces, which rank as second and third in terms of forced marriages, fertility rate, and sexual gender-based violent rates.
In order to address sexual reproductive health and rights challenges, my Age Zimbabwe believes in empowering adolescent girls and young women to take the lead in advocating for review and change of consent laws around contraceptives and to work in communities to change knowledge, attitudes, practices, and behaviors that are harmful and hinder access to sexual reproductive health and rights services and commodities by adolescent girls and young women. We believe that young women have the capacity to influence change as key beneficiaries, and it is essential to empower and ensure their participation at all levels of the project cycle. As Girls Choose Smart Contraception Champions from Masvingo, we are engaging in the following interventions which we intend to scale up. Adolescent girls and young women led dialogues with community leaders to address cultural and religious norms which hinder young people to access sexual reproductive health services. Linkages and referrals of adolescent girls and young women for family planning services as long as they are sexually active. Mobilizing adolescent girls and young women to access contraceptives from mobile clinics usually done by the Zimbabwe National Family Planning Council. Community mobilization using theater and sport building bridges between adolescent girls and young women, their communities, and sexual reproductive health and rights, especially family planning service providers. Dialogues with service providers and policymakers on age of consent to sexual reproductive health and rights services to be lowered to 12 years.
Expected results include 25 trained adolescent girls and young women as champions for the campaign. Increase in community support to adolescent girls and young women when accessing sexual reproductive health services, that is household budgets, to also cater for user fees where applicable. Petition with 2,500 signatures from young people on lowering age of consent submitted to high-level policymakers in Masvingo who will facilitate engagement at national level. Change perception towards sexual reproductive health issues within communities through demystification of cultural and religious norms around adolescent girls and young women's sexuality. Enhanced parent-to-child communication. Decrease in family planning and unmet needs for unmarried adolescent girls and young women. Smart investments in family planning
equals smart contraception
and smart future for adolescent girls and young women.